Let's settle for the details now. Let's begin on a health note because malaria-related deaths are on the steady decline. Well, this is according to the National Malaria Control Program. It reduced from 1,264 in 2016 to 599 in 2017, more than 50% reduction. And then in 2018, it further reduced to 428. That's 29% decrease as compared to the 599 in 2017. At a press briefing to launch the World Malaria Day, Programs Manager of the NMCP, Dr. Kezia Malm, said the interventions introduced by the NMCP is achieving the intended results.
We have made progress when it comes to malaria deaths over the years. In 2015, we're recording about 2,100 deaths in our health facilities. In 2018, we recorded around 428 deaths. That is a great reduction. If you look at of the proportion who are admitted for malaria, how many died? In 2015, 2012, we had 60 out of 100 dying. Currently, we just have about one person out of 60 out of 1,000 dying. Now we have just about between 1 and 2 people dying out of the 1,000 people who are admitted for malaria. So we've made a lot of progress in reducing the number of deaths that people that occur due to malaria. Our interventions that people take up has also improved. Last year we distributed over 15 million. If you look at the pregnant women, last year there was an improvement in the proportion of pregnant women who take SP for intermittent preventive treatment. However, we have a challenge when it comes to those who use the net. So it's always been the case, people take the nets and they don't use. So you have a higher number of people having the net as compared to the number of people who actually use the nets. We still also have a challenge in terms of the disease, those who are affected by disease, because though there has been a reduction in the proportion of outpatient attendance due to malaria from the 40% to around 35%, it's still the #1 cause of outpatient attendance in our country.
So now, what are the interventions that you're putting in place to correct this, probably, if I should put it, anomaly?
So we have a number of interventions that work, and I think I mentioned the use of insecticide-treated nets where people don't use. So in fact, one of the key things we are working on is getting the right information out. That's why the media comes in. Adequate social and behavioral change communication, advocacy at all levels, community mobilization for them to use these interventions that have been seen to work. So sleep under your net, open your doors for the workers to come and spray your room if you're in an area where there's indoor residual spraying. Pregnant women should take their SP when they go to the antenatal clinic. If you feel you have symptoms of malaria, if you feel unwell, don't just get up and get treatment. Make sure it's tested to confirm that it's malaria before you get treated, because it could be something else. Also this year we are going to pilot the malaria vaccine in 3 regions, so that's an additional 2. We are adding on larvicidin, which is going to kill the babies of the mosquitoes, so that's an additional 2. We are using all efforts to make sure that we accelerate the fight against malaria.
Okay. Well, Director of the Public Health Division of the Ghana Health Service, Dr. Bedusa Akodie, also says there is still more to be done, even in the face of these achievements.
We are doing a lot. We've had a lot of significant gains. Notwithstanding, we still have a huge gap. As much as possible to move from control mode to pre-elimination. The pre-elimination mode, the malaria prevalence should be less than 5% and not more. And as we speak now, we are more than 20%. So irrespective of all these gains, there is still a huge gap. And that is the need for us to increase the scope. That is the need for us to increase the intensity of all the various preventive mechanisms that we are doing. To mention a few, the vector control using the ITN, the vector control using the larvicidal, the vector control cleaning, making our environment clean so that it doesn't provide the good environment for the malaria parasite, the mosquito to breed in. So that's the vector control. Case management is very important. Should somebody die from malaria, it means that the person may have reported late, or the treatment was not optimal. So we have to encourage people to report as early as possible to the nearest health facility when they have symptoms that could be malaria symptoms. And health workers should be up-sitting and upstanding, and when the cases come, pick it, investigate quickly. We have clear, now all the facilities have the rapid diagnostic test. So you say, test, you treat and track, so that if we do this adequately, we would conquer malaria quite on time than the time that we set for ourselves.
Dr. Bedu also outlined some interventions that the NMCP is putting in place to sustain and improve on these successes recorded.
We have other interventions like SMC, the seasonal malaria chemo prevention. We're doing it in the two upper regions, Upper East and Upper West, and now we are going to increase the northern region as the third region to do that. Indoor residual spraying, where we use insecticides to spray inside the walls and some of the linen, so that when the mosquito sits on it, the either repels them or they die off. So these are the things that we are doing, and as much as possible encouraging the health workers to intensify the testing, so that every fever, whether it's a viral condition, whatever it is, you say malaria. We've been progressing over the years to beyond 80% now, but then all cases of suspected malaria should be confirmed, so that we will know clearly the burden that we have on hand. And finally, we are adding an additional tool on our toolbox, the malaria vaccine. And this has been found to provide quite a good efficacy, quite safety profile, and we are doing this as pilot introduction in 3 regions, then being the Brong-Ahafo region. Now Brong-Ahafo region alone is 3 regions: the Bono East, the Ahafo, and then the Bono region, and then Volta region. It's now 2 regions. So that would mean that both OT region and the Volta region, and then the Central region.
Dr. Bedu Sarkodie there. Well, this year's World Malaria Day celebration will be held at Somania with the theme Zero Malaria Starts With Me. Joining me here in the studio is Dr. Nanaya Opepra. He is an epidemiologist for the NMCP. He's going to throw more light on the program and as well as what we need to do. Because even though you listen to Dr. Sarkodie say we've made some successes, he still says there is still a huge gap that we need to fill. Doc, you're welcome. And thank you very much for your time this afternoon. So this is quite exciting news, isn't it?
Yeah.
Right. So we're talking about malaria this afternoon, basically, as I said earlier on, because it is World Malaria Day and we're celebrating it here in Ghana. And this happened today.
No, it's 25th.
It's
25th. So 25th April of every year is World Malaria Day.
So what you did today was supposed to
press
be
briefing, yes, trying to ensure that we get the information out, of course, through the media.
All right. And the information you're getting out, which sounds a bit exciting, is that we're making progress. Yeah. We're making some progress. And I was trying to track the figures that were put out by Kezia when she spoke, Dr. Kezia when she spoke. She's saying that if you look at as of 2012, you take about 60 people out of 1,000 were dying from malaria. But right now, and I don't know if that's statistics up to 2018 or 2019, but if you take 1,000 people, between 1 and 2 are dying.
Yes. And I think that just as my boss mentioned, using the raw figures, you're looking at, say, 2,137 people died in 2015 as compared to 428 people dying. We don't want to have anybody dying, but we are just looking at the progress that have been made, and we are thinking that the interventions we have put in place is working. That is why we have seen this decrease. Okay. And why are we saying that? We know that malaria control has put together a number of interventions: indoor residual spraying, the insecticide treated nets, and also encouraging people to go to facilities and get tested, because not all the fevers are malaria. So when they are tested, we have very good medications, the ACTs, which people take. And when you take those medications, you are treated, and therefore you don't die. So one of the key issues is the fact that people get to the facilities early, they get treated, and when you are treated, you don't get complicated with malaria, and therefore the possibility of dying. And with all the interventions we have put in place, the preventive interventions, the case management interventions, they are virtually showing these results.
So you say that the preventive interventions are what's doing the trick for us?
Yes, because you have less cases of malaria.
Okay.
Then the cases that go to the facilities too, because we are training the medical doctors, because we are training the biomedical scientists, they are able to identify the plasmodium. You also give them RDT, so they are able to say that this is malaria, this is not malaria. And you're also able to give them ACT, so when they see malaria, they treat malaria. So because this have been made available, I mean, if you go to pharmacies, they have RDTs. So you have, yes, you just test, and if it's malaria, you are treated. Because of all these interventions, so preventive is to prevent malaria. If in the unfortunate event that you get the infection, what happens is that people will have to be treated, and we have very effective medications to treat them, and therefore mortalities will decrease.
We've seen this. I've seen some slides that you have here that says that Ghana is at the control phase, and I can't really understand that. What does it mean to say that Ghana is at the control phase? Can you explain this to us a bit?
Great. So what usually happens is that for most countries, you will have to move from one phase to another.
Okay.
When you're in the control phase, basically what it means is that your slide positivity rate is more than 5%. If you get to less than 5%, you say you are in the pre-elimination phase, right? So you will see that pre-elimination less than 5%. And basically Ghana, our slide positivity rate is around 20.6% from Malaria Indicator Survey 2016. We also have sentinel sites we use in measuring the slide positivity rate. So basically, we are in the control phase because of our slide positivity rates we have in this country.
And it means that our quest to reach the end of the tunnel, really, how far have we come with that?
Great. So we want to reach elimination. Elimination is when you are not recording cases locally.
At all?
At all. That's what we want to get to. And
possible?
it is possible. It is very possible.
Okay.
That is why it is interesting that this year we all have to agree with malaria control and say that zero malaria starts with me. Okay. We believe it is possible, but if we are all going to get our hands together and ensure that we are using the interventions and the small contributions we can be making from the media and from all other stakeholders, we are sure that we'll be able to get there. So we want to get to zero malaria by, say, 2030.
By, say, 2030 or 2030, what's our target?
Hopefully by 2030 we should get there.
2030 is a target?
Yes.
Okay.
By 2030 we should have zero malaria. Now we are around 20.6. Our sentinel site figure actually gives us 15.3% sentinel site data. This year, God willing, we'll have Malaria Indicator Survey 2019, and that will give us the latest estimate on the slide positivity rate. So if we are coming from 20.6 in 2016, moving to 15 in 2019, I'm sure roughly by 2030, we should be getting zero.
I see. I mean, these are very technical figures, the way you put it. I mean, at the end of the day, we want to be excited about the fact that fewer people, I mean, from 600 people dying to between 1 and 2 dying, according to the statistics, that's quite good. But Dr. Bedisa-Akode, for example, says that there is still a huge gap. How come people are not dying? I mean, from 600 people dying, we have 1 or 2 people dying. Where is the huge gap here?
So we've made progress, but honestly, we still have a lot more to do. We still have some people going to the facilities very late. If you have symptoms of malaria and you start treating with all kinds of treatment, the herbal medications and etc.
But isn't herbal medication okay as well?
It has to be proven scientifically to be okay.
Okay.
You understand? We should have all the possible adverse events on the medication. For instance, if you take We know all, I mean, if this dosage is good for this, if you take more than this dosage, it can give you hepatitis, can give you so many adverse events. When you pick some of these herbal medications, you can't find some of this information on them. That's why we are saying that, I mean, we don't want to go into that area now, but the truth is that herbal medications will work, right? But we should take it through all the processes, all the other internationally accepted medications have gone through. Right. Okay. What I'm trying to say is that it is important that when we are unwell, we go to the facilities. When we are tested and it is positive, then we are giving the treatments that have been proven scientifically to be working. Right. And most of the countries that have gone into elimination and also even thinking about pre-elimination now are using the same interventions we are using. Just that their uptake has gone up. And so I'm sure we'll be talking about some of the issues like why people are not sleeping under the nets, why some pregnant women don't get intermittent preventive treatment, why some people don't use indoor residual spraying. So there are gaps. Okay. And because those gaps are there, we've not gotten to where we wish we could get to as a program. Okay, and what are the interventions we are putting in place to deal specifically with these gaps that we've identified? Great. So for instance, when it comes to people sleeping under the nets, we know it's a behavioral issue. So we actually counting on the media and the other stakeholders to ensure that we educate Ghanaians on the need to sleep under the nets. And I mean, the pregnant women, when you get pregnant, 16 weeks, you are supposed to take a medication called sulfadoxine pyrimethamine. This is to help reduce the chances of getting malaria and its consequence on you, the mother, and the baby. So from 16 weeks, monthly to delivery, you take this intervention. You also have the indoor residual spraying. It's an intervention which is done in some part of the country, especially in the Upper West, some districts in the Upper East, Northern region in Obuasi, where the interior walls of rooms are sprayed with chemicals. And the residual on those chemicals stay on the walls for 6 to 9 months. When the mosquito bites and rests on those walls, they imbibe the chemicals and they are knocked down. Okay. Right. So with this intervention, if we encourage people to use this intervention, we are very sure that in a very near future, we should be saying zero malaria. Zero malaria is something I'll be excited about because when you travel elsewhere, you would hardly hear people complain about mosquitoes anyway, and not to even talk about malaria. And so it will be interesting to have Ghana record that zero malaria free. But finally, before you go, Doc, when we say that the statistics show that there is a steady decline in malaria infections, are we looking at what's happening nationwide, or is there any imbalance, in terms of regional representation of the figures? Great. So from the Malaria Indicator Survey 2016, you will realize that even though the whole country has an average of 20.6, Greater Accra had 4.9%. So it means that the chances of getting malaria in Greater Accra is lower, far lower. Yes, okay. It's 4.9%. And the highest is actually Eastern region. Eastern region. 31%. Right. Wow. Eastern region happens to be one of the cleanest places. Yes, unfortunately, when we did the Malaria Indicator Survey, we realized that it's now the highest. It used to be the 3 northern regions. Okay. So you had Upper West, Upper East, Northern region. And we put in interventions like the indoor residual spraying, like the seasonal malaria chemo prevention, and now it's come down. Okay. Right. So even though the whole country is moving towards a downward trend, Eastern region is not seeing a significant reduction. Okay. And we've done studies and we realized that the key issue was BCC, behavioral change issues, and it's something that the program is looking at in critically. The Eastern region. I mean, once you've realized the problem, that's half the problem solved. Yeah. So that's half the solution. But Doc, I'll say a very big thanks to you. But I want you to just say, use this platform to send out a message to persons as part of your campaign to reduce malaria. What should people know? What message you want to leave with people as you celebrate, as we all celebrate World Malaria Day? What is that one message you want people to go away with in this from this interview? Yeah. So it's important you mention as we all commemorate this because it's not only about National Malaria Control Program. Yeah. So we are saying that zero malaria starts with me. It starts with you. It starts with the prescriber. It starts with the Ghana Health Service. It starts with the president. Okay. We are saying that this zero malaria should be kept high on the political agenda. We are saying that let's raise domestic funds. We need companies to come in. Let's ensure that by 2030, we don't want to hear about malaria. If you have a mosquito net, sleep under the net. It is very, very important. Studies have even shown that when the chemicals are more or less gone and the mosquito is not knocked down by the nets, it's still protective. So let's sleep under the nets. If you're in the area of seasonal malaria chemo prevention, ensure that your child takes the medication. Okay. It helps. Okay. So we are hoping that if we uptake all this intervention very, very soon, Ghana will be malaria-free.
Malaria-free. Ghana, that's malaria-free. That's what we're looking forward to. And indeed, we're looking forward to, what, 25th?
25th April.
25th. Yeah. 25th April, that is World Malaria Day, and the National Malaria Control Program is, sharing with us the successes that they've chalked. In the studio with me has been Dr. Nana Yao Prepra. He's an epidemiologist with the NMCP. So, malaria prevention starts with me. It starts with you. Doc, thank you very much once again for coming.